Hello students and welcome to the course 21 SMAC 234B Analysis of Controlled Substances. In this video we are going to discuss the analysis of barbiturates and benzodiazepines. While analyzing the controlled substances in the forensic labs, the scientists will sometimes be faced with the casework involving the samples which is diverted from the permitted sources like commercial or the industrial sources. The most significant of these are barbiturates, often found in heroin samples, and the benzodiazepines. Both are found under a wide variety of trade names, but the approach to their analysis is almost similar, either when the material is encountered in the native dosage form or when it is a part of a drug mixture. The barbiturates are the central nervous system depressants. They reduce the activity of the nerves, causing muscle relaxation. They can reduce heart rate, breathing, and blood pressure. Barbiturates affects the neurotransmitter gamma aminobutyric acid that nerves use to communicate with each other. The barbiturates are used to treat headache, insomnia, and seizures. Similarly, the barbiturates are a group of drugs in the class of drugs known as sedatives, hypnotics, which generally describes their sleep-inducing and anxiety-decreasing effects. The barbiturates can be extremely dangerous because the correct dose is difficult to predict. Even a slight overdose can cause coma or the death. While the benzodiazepines use has largely replaced the barbiturates in the medical profession, with the exceptions of a few specific indications. Benzodiazepines act as a sedative, slowing down the body's functions, and are used for both sleeping problems and anxiety. The benzodiazepines are central nervous system depressants that causes sedation and are used to treat anxiety disorders, nervousness, panic disorders, muscle spasms, seizures, sleeplessness, alcohol withdrawal, status epilepticus, premenstrual syndromes, and as a sedation during the surgery. Benzodiazepines may work by enhancing the effect of the neurotransmitter gamma aminobutyric acid in the brain. When a seizure of pharmaceutical drug is made, it may comprise a single dose unit or many tens or hundreds of thousands of the units. The number to be analyzed is recommended by the United Nations Drug Control Program for commercially produced drugs. If the seizures are in between 1 to 50 units, then 50% to a maximum of 20 chosen at random should be analyzed. If the sample containing between 51 and 100 units, 20 should be analyzed. For samples between 101 and 1000 units, 30 should be chosen. And while for the samples greater than 1000 units, the square root rounded to the nearest integer should be analyzed for barbiturates and benzodiazepines. Once the material to be examined have been chosen, it is then a matter of identifying and quantifying the specific drug present. In order to achieve this, a full physical description of the material should first be carried out. If the dose form is not included in the database, a full chemical analysis including drug extraction from the tableted material, presumptive testing, thin layer chromatography, and a confirmatory technique must be undertaken for the analysis. The extraction of barbiturates and benzodiazepines from the dosage forms can be achieved in a suitable organic solvents. The barbiturate in either the free acid or the salt form are readily soluble in methanol. and thus this is the solvent of choice for the extraction in qualitative analysis. A known mass of the dose form is dissolved in a volume of methanol to provide the drug component at a working concentration of between 1 and 20 mg per ml. The extract should be filtered or centrifuged prior to the analysis in order to remove any unwanted particulate materials. For quantitative analysis, ethyl acetate can be used as the extraction solvent for barbiturates. Several presumptive tests are available for barbiturates and benzodiazepines. The Delhi-Kopiani test for barbiturates and Zimmermann test for benzodiazepines are commonly employed. The test for benzodiazepine is used as a simple spot test to identify them from the sample. This test is composed of a mixture of two solutions. The part A is 0.1 gram of cobalt acetate dihydrate dissolved in 100 ml of methanol mixed with 0.2 ml of glacial acetic acid, and part B or the second solution is of 5% isopropylamine in methanol. Two drops of solution A and two drops of solution B are mixed with the sample and any color change is observed. If barbiturates are present in the sample, they produces a purple color which indicates a positive presumptive test. While for benzodiazepines, the Zimmermann test is used and it also requires two reagents. The first of these reagents is a 1% solution of 2,4-dinitrobenzene in methanol, and the second reagent is a 15% aqueous KOH solution. One drop of the first reagent followed by one drop of the second reagent is added to the test sample, and the development of a red-pink color indicates the presence of diazepam or some other benzodiazepines. Once the barbiturates and benzodiazepines are confirmed in presumptive tests, then the analysis or thin layer chromatography analysis can be carried out. The TLC system most commonly employed uses a silica gel plates and a mobile phase of ethyl acetate, methanol, and 25% ammonia for barbiturates. The plates are prepared and the chromatograph developed in the standard way. After development, the plate is removed from the mobile phase and the solvent front is marked and the plate is dry. The visualization of the barbiturate is best achieved by the use of mercury chloride diphenyl carbazole reagent. And if the barbiturates are present in the sample, they will react with this reagent to give rise to blue-violet spots on a pink background when visualized. While the benzodiazepines are a diverse group of drugs and require a combination of different TLC solvent systems to resolve the many drugs in this group. The systems which have been used include a mixture of chloroform and acetone and a mixture of cyclohexane, toluene, and diethylamine. The developed TLC plate is sprayed with 1 molar H2SO4 and after heating it is subsequently viewed under UV light. Any fluorescent spots are recorded and the chromatogram is then oversprayed with acidified potassium iodoplatinate reagent which forms purple spots. If the color reaction observed for the sample and the standards match, then further analysis will be required. The benzodiazepines and the barbiturates in the sample can be confirmed by analyzing them using GCMS technique, and both barbiturates and benzodiazepines can be identified by using GCMS methodologies with different procedures. Due to their highly polar nature, barbiturates requires derivatization prior to the analysis by GCMS. And in such cases, the sample is dissolved in methanol, centrifuged, the supernatant is recovered and placed in a derivatizing vial and is then blown down under nitrogen. The derivatization is carried out by using zero point 0.2 molar trimethylaniline hydroxide in methanol, and the principal procedure is same as that used for other pre-column derivatizations. A typical mixture comprises 100 microliter of zero point 0.2 molar trimethylaniline hydroxide in methanol containing 0.1 milligram of the internal standard, and the sample vial is closed and shaken. The system is allowed to derivatize at room temperature. Similarly, we can directly transfer the reaction mixture onto the heated injection block of the gas chromatograph, which will overcome the problem, and derivatization reaction can be proceeded at this temperature easily. After derivatizing the sample, it can then be analyzed by GCMS using the operating conditions as shown in the table. The column is BP1 with a length of 25 meter and 0.22 millimeter inner diameter. The injection temperature is 290 degrees Celsius, column moment temperature is 200 degrees Celsius, and the carrier gas is helium, and the flow rate is 1 ml per minute. The detector used can be mass spectrophotometric detector with the temperature settings, and by employing this system, it is possible to analyze and identify barbiturates in the casework samples or the seized samples. If the retention time and the mass spectral data obtained for the standard and the components of the drug sample are the same, then an identification can be called and barbiturates will be confirmed in the obtained sample. The benzodiazepines can be conveniently identified by GCMS analysis, and this class of compound does not require derivatization and thus can be directly analyzed from a solid free methanol extracts of the drug sample by using the typical operating conditions. Again, if the retention time and the mass spectral data obtained for the standard and the casework samples are the same, then the identification can be called and the benzodiazepines presence can be confirmed in the seized sample or in the obtained sample. Please follow the link in the description box for detailed notes and the question bank of this chapter.